Good evening, good afternoon, and good morning. This is the 2022nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Hari Kumar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic lover, student, or doctor. It doesn't matter much. But the purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is a multi-specialist, Dr. Hari Kumar G. Doctor is an MBBS, DHMS, BHMS, MD, Homeo, MD Ayurvedic Medicine, MD Ayurvedic Medicine, and MD Modern Medicine, a diploma in N.Y.T, that is Yoga Naturopathy, and MBA and LLB. He served as Assistant Director, Government Health Service, Kerala, and was the ex-State Commissioner, Government Secretary, ex-officio, Government of Kerala, ex-Honorary Lecturer, Sharda Krishna, Homeopathic Medical College, Kanyakumari, ex-Honorary Lecturer, White Memorial, Homeopathic Medical College, and he has more than 40 years of clinical experience, and he is a well-known doctor everywhere because he has presented so many sessions in homeopathic forums nationally as well as internationally. And at IFBH also, doctor has presented some brilliant sessions earlier. And today, doctor is talking about a wonderful subject, a very important subject, that is cancer prevention, homeopathic medicine approach. This is a very, very big subject because how to prevent cancer, that's the biggest challenge among public as well as doctors. Let us see what Dr. Hari Kumar to say about this. Welcome, doctor.
Hello.
Yes, yes,
Can you hear?
yes, yes,
Is
doctor.
it audible and visible?
Yes, yes. You can adjust your camera a little more. Try to
Okay.
adjust your camera.
Okay. Thank you. Thank you. This is, I think, IFPH is 2022 webinar, 22nd webinar. Today's topic is preventive oncology, role of homeopathy, and outlook. Actually, when you take oncology, you can have two type of thing. One is treatment part, and the other one is preventive part. I am discussing today only about the preventive part. The treatment part is there are different webinars in the IFPH platform itself, and still it is continuing. And I am also ready to take one webinar in treatment of cancers. But today my topic is preventive oncology. Actually, can you open that? Slides.
Great.
Yeah. Dinesh, please try by the time I give you an introduction. Okay.
Yes.
Yeah. Today, my webinar is mainly on a topic of prevention of cancer. The cases that comes to homeopaths, mainly it can be early diagnosed cases, it can be not diagnosed cases, it can be cases of completed treatment or even under treatment, or it may be for complications. Uh, Before starting treatment, first thing is all cases you have to diagnose it properly. If you are not able to complete the diagnosis, you refer to better oncologist and get it diagnosed. And it is a must always you make the tumor markers values and all. It is very important. And MRI status and CT status, ultrasound status, everything should be recorded to be scientific. Then how to proceed if a case comes? First thing is you get it diagnosed, and whether it is a fresh case or it is a case going on treatment or completed treatment, or patient is coming with complications, or a patient is coming with the complications during treatment, or after completing the treatment, recurrence. That usually, if you get 100 cases of cancers to a homeopath, most of the cases will be recurrence. In my last 40, I am practicing for 48 years, and for the last 40 years, uh, I am I'm getting cancer cases or oncological cases. Out of this, if you take 100 cases, out of these 100 cases, 70 to 75% of cases will be recurrence. Usually, the patients will come only after completing the mode of treatment or protocols of treatment by the modern medicine people. And when it recurs, they approach us a doctor or other systems like Ayur system of treatment doctors. Here, one thing you have to remember very important is you have to understand the limitations that you can do, and that should be explained to the patients also. Uh, I would say one very important point from my practice point of view, that is, if a patient is brought to you by one son or one daughter, or even by wife, or by a close relatives, you should explain your possibilities and what you can do for that particular case, and they should convey this information to all the members of the family, especially their sons and daughters. Why? Because when something happens in later, they will blame the person who brought this patient first to us. So you should get a concurrence from all the family members. That is very, very important. Otherwise, you will be in trouble. That is very important, especially if a case is coming after a recurrence. So you explain to the person the probabilities and the scope that you can have with homeopathy, and it should be explained by this particular family member or the attendant or the patient to other family members also, and with their concurrence only you should treat, otherwise you will be in later. That is a very, 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 very important point in the private practice. Okay. Yeah. When a fresh case comes, or when a case comes after recurrence, what I am saying is always from my practice also, from cases, from my experiences from my practice. Why? Because I am not going to the detail of the medicine indication, the keynote symptoms or the repertorial symptoms and all of them. Only my experience I am telling here. That is, when a fresh case or a fresh diagnosed case comes to me, I will directly go to, after explaining the possibilities and after the explaining the this thing, we will go to treatment. Or if they are not diagnosed, better you can, if you can able to diagnose, you diagnose it. Otherwise, you send the patient to an oncologist, get it diagnosed. If they are coming to us after completing the treatment, then you can directly involve, or you can directly take the cases. If they are coming after as recurrence, then also you can take. Then if a case is coming, first what I used to do is I will give a medicine, especially two medicines are very, very important. That is, one is if melandrinum. Invariably, majority of the cases, I gave melandrinum to control the state. Then only I will go into detail. I give you a few doses of melandrinum to control the cancerous state or the state of the cancer. That is very, very important. Then it can be, the other medicines can be vaccinum, or it can be thuja, or it can be variolinum also. That is the first line. Then I can as you know, the modern medicine, they got three modalities of, three or four modalities of treatment. One is surgery, the other one is irradiation, other one is chemotherapy, and hormonal therapy, or now latest immunotherapy also. So if it is what I used to do is, what I am saying is what my practice is. You can differ, and it is debatable also. If it is operable, I will advise to do an operation to remove the tumor. That is a first line of treatment. I give a few doses of the melandrinum and refer the patient to the onco surgeon and ask him, and request him to remove the tumor. And after that, the patient can come back to us for treatment. Then regarding the irradiation and regarding the chemotherapy, it is again debatable. Actually, if you go into detail, the irradiation and chemotherapy is not a curative way or curative line of treatment, except a few cancers, except few cancers. Then what is the role? If you give chemo, the mass will be, usually if you take as an example breast cancer, before surgery, the oncologist will advise to have a few doses of chemotherapy. Why? Because you can shrink, or you can concentrate the mass, and you can do very easily the surgery. Like that, the chemotherapy is having only having a limited use, or it is not actually curative except a few cancers. If there is a cancer in the colon, and the patient is not passing motion properly, then if you give a few doses of chemo, the mass will shrink, and sometimes the passage will be established. Like that, similarly, the radiation also. If you irradiate, if there is secondaries in the bone, it will give, and the patient is complaining of severe pain, he will get relief of pain only. But regarding the growth of the cancer, or regarding the effect of the cancer, there is not much value except a few cancers in radiation treatment and in chemo treatment. Another very, 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 very important, you have to explain to the patient is, if a patient comes took treatment for cancer, for by doing a surgery, by taking chemotherapy, by taking irradiation also. So are the main modalities of treatment completed? And if you ask the oncologist, what is a prognosis of the patient, then the oncologist says it is 100% cured. When the oncologist says it is 100% cured, it means that you will, in majority of the cases, you will live for 5 to 10 years. That's the only guarantee. That's the only guarantee. 100% means you will live for 5 to 10 years. Sorry. Lakshmi, എന്റെ മൊബൈൽ മോളിൽ ഇരിക്കുന്നു. സോറി, ഇവിടെ ഉണ്ട്. ഹലോ.
Yes, you can. I have tried it, but it is the person who was supposed to share was not available now. I am trying
Okay.
from my phone, but the document is not supporting the phone. That is the problem.
Okay.
We will try from another person also. I am trying.
Okay.
Please
It's okay. So if you completed the modern medicine treatment like surgery, chemotherapy, and radiation, and if you are asking the doctor what is the present prognosis of the patient, then the doctor will say your disease or your cancer 100% cured. That means you will live for 5 to 10 years, and it may or may not recur. So that is the approved prognosis. So usually the patient will think that it is completely cured, will not recur, but usually it recurs after 10 to 10 years. Then only they will come to us. So the majority of the cases come to the Ayush people or to the homeopath is recurrent cancers. So that is the main problem. Then here another thing I want to tell as introduction is the cancers can come from as you say, from interior to exterior, or from exterior to interior. Both ways it can come. For example, if you take from exterior to interior, if you have an artificial ill-fitting denture, then it will cause an irritation of the gum, or irritation of the tongue, or irritation of the cheek. Then after a few years or so, it will result in a small ulcer, and that ulcer will continue. After years, it will turn into malignancy. That is because of the irritation which is occurring from external, and the cancer is developing from external to internal. That is from Sora to syphilis. Or otherwise, it can also occur. That is from internal to external. That is, if you have a sudden emotional trauma, or if you one of the family member is lost, then after a few days you will develop cancer all of a sudden. That is an example of from interior to exterior. Then you will see that a small tumor is developing in your brain, and that is producing later paralysis, epilepsy, and so on and so forth. That is from internal to external. So both ways it can occur, and the treatment also varies. So here I am not going into the treatment of the cancer. As I told earlier, my topic is homeoprophylactic treatment. Here, the homeoprophylactic treatment can be divided into three phases. One is pre-cancerous phase, the other one is cancerous phase, and the third one is post-cancerous phase. The first one is pre-cancerous phase, second one is cancerous phase, and third one is a post-cancerous phase. Here, the pre-cancerous phase means it can be in families, genetically determined. It can be run in families, or it can be there can be a pre-malignant lesion which later changes into malignancy, or there can be a lesion which is potentially malignant. So these three are the pre-malignant phases of cancer. Here, first you take the familial tendency. The parents are parents suffered from oncological disorder. For example, the breast cancers or the intestinal cancers. These are run in. This can be run in families, either the parents, or it can be in blood relatives of the family members. Next, it can be a second thing is it can be a pre-malignant lesions. The pre-malignant lesions are moles, neurofibroma, dermoid cyst, ulcerative. All this I am not going into detail. Leukoplakia, adenomyosis, fibroid cyst, PCOD, adenoma thyroid, intestinal polyposis, achalasia cardia, gastric ulcer, congenital polyposis coli, cirrhosis of liver, hepatitis B and C, fissure in ano, chronic cystic mastitis, Paget's disease, Plummer-Vinson syndrome, genital herpes simplex. Moles, neurofibroma, dermoid cyst, ovary, fibroid ulcers, and adenomyosis of breast. Then Paget's disease, rodent ulcer, then certain warty growth, certain brain tumors. The potent diseases or potent lesions or states which can turn in later years to, or these potent conditions can precipitate cancer in later years after running years. They are non-faded breast and non-pregnant uterus, multiple pregnancy, multiple sexual partners, cirrhosis of liver, cirrhosis breast, smokers, cervical viral infections, brain scars, alcoholism, and drug use. These are some potent conditions which can bring out cancers in later years. Then first, I said precancerous state. Precancerous state can be familial, and precancerous state can be due to certain precancerous or potent lesions or potent state. Second is a cancerous phase. Cancerous phase, it can be recurrence or it can be a spread. Recurrence means the recurrence can be the same lesion can be recurred, or the lesion can be, the same cancer can be resulted in another organ or some other organ or a general spread. Then spreaded, as you know, it can be local spread or by means of infiltration or by means of migration. Next is a distant spread or indirect spread. That is, it can be lymphatic spread, blood through the blood or through the body cavity. That is Krukenberg's tumor. Example, migration through the blood vessels, especially veins, as in case of renal cell carcinoma. Then it can be due to surgical manipulations, or even it can be iatrogenic or doctors producing. Spread spread to the local spread, as you know, the contact between going into deeper of the breast cancer, going into deeper tissues, or contact with the upper lip and lower lip, from spreading to lower lip, from upper lip, or through the lymphatic, it can spread to the opposite breast or to the lymph nodes. Migration, as I said earlier, from lower lip to upper lip or from upper lip to lower lip. Then it can be through the body cavity. Example, from gastric carcinomas, that cancer cells will be denuded off from the side and it will fall onto the pelvic cavity, and a Krukenberg's tumor can arise. Next is renal cell carcinoma. As I said earlier, through the vein, it may spread to the other part of through the renal vein, it may spread upwards. Blood, example, through the blood, prostatic carcinoma can spread to the bones, to the liver, to the lungs, etc. Leukemia, of course, it is generalized. Then the type of modern treatment, you can have surgery, you can have chemotherapy, you can have a combination of any one of this. Then you can have hormonal therapy, or you can have immunotherapy. Then the last thing, C is post-treatment. Post-treatment phase, the prevention is you can prevent the complications of cancer, complications of treatment, and you can prevent the recurrence. This is very important. This 20th slide. This 20th slide. So the post-treatment prevention, mainly a complication of cancer prevention and complication of treatment prevention and recurrence prevention. Complication of treatment prevention, it can be complication after doing a surgery or giving a radiotherapy or chemotherapy or immunotherapy or hormonal therapy. Recurrence, it can recur in the same site or it can recur in different sites or in multiple sites. Or the recurrence can be of the same pathological type of cancer or can be a different pathological type of cancer. Then coming to complications, I am not going to much detail. Bleeding, as everybody knows, vomiting, ulcerations, then constipation, then diarrhea, neuritis, loss of sphincteric actions. Depending upon the site of the cancer and the nature of the cancer, these complications can occur. Stricture, alopecia, body fluid accumulation like ascites, pleurisy, etc. Next is the prevention and treatment of complications. But before that, yeah, as I said, as a homeopath, usually I start even before surgery or patients coming for the first time after surgery or with the meds. I will start the treatment with one of the drugs like melandrinum or variolinum or calcinosin or viscomaldol. Any one of these drugs is the first one to start with. Then, if they are coming before surgery, after giving this any one of these drugs, I will give a few doses of silicea. Why silicea is given? Because when they manipulate by doing surgery, the cancerous cell will not be sticking to the normal cells and will not allow further spread. That is the idea of giving silicea. Then after doing surgery, when for example, if you take breast cancer as an example, if they come after doing a surgery, usually I start the treatment with one of these drugs, that is a Bediaga, Carboanimalis, or Plumpum iodatum, or Conium, or Mercurius iodatus flavum, or any one of these drugs according to the condition of the patient. The drug selection and all of you know, but these drugs have a preferring action over the breast tumors or breast cancers. They are the Bediaga, Carboanimalis, Conium, Plumpum iodatum, even arsenic iodatum, and Mercurius iodatum flavum. These are the drugs which to start with the breast tumor. Then if it is lung cancer, usually I start the treatment with ELAP score. If it is related with the uterus and ovary, usually I try the treatment with trifolium. And if it is liver, I usually start the treatment with chionanthus. If it is lymphomas or something connected to the lymph nodes and all, usually I start the treatment with the cystus. And if it is liver connected, in addition to the chionanth, if it is secondary to alcoholism and chloridum is the medicine which I usually start. If it is related to the blood dyscrasias and thyroid and all, usually I start the treatment with echinacea. So these are the drugs according to the type of cancer usually you can start. Then in between this, as an intercurrent remedy, I use to give intercurrent remedies like aloes, like calcarea arts, arsenic album, calendula, and gallium aparne. These are the drugs which you can use as an intercurrent remedies. Example, aloes, calcarea arts. Aloes, especially the patient is coming after taking a lot of drugs, modern medicine drugs, as well as the homeopathic drugs. To make it a homeostasis, you can give aloes. Then calcarea arts to get. Then arsenic alb, then calendula, then gallium aparne. Gallium aparne, especially if there is cachexia and all, you can give gallium. So these are the drugs usually we can give to start the treatment. Then if there is multiple sites recurrences, you can give viscum album, visca album. Then coming to the, if there is a hair fall following chemotherapy or even otherwise, to prevent that, we can give fluoric acid. If there is a hormonal imbalance like amenorrhea following treatment, whether even in chemotherapy or even in cancer, you can give platinum and arsenic acid. Then so if there is any hormonal imbalance, the main medicine is platina and arsenic acid. If there is estrogen abnormality, then you can give pulsatilla, progesterone abnormality, simicifuga, and testosterone, it is sabadilla. Then after the patient is coming after chemotherapy, and if they used the alkylinating agents like in modern medicine like a cyclophosphamide, melphalamine, and chlorambucil, you can give a few doses of 30, Tuja 30, and then start your medicine. Then it will be more effective than giving without using antidote to these. Next is if the patient is coming antibacterial medicines like methotrexate or 5-fluorouracil or mercaptopurine, then you can give few doses of Mersol. If they are coming after using tumor antibiotics like actinomycin D or mitomycin D or bleomycin, you can give, if it is actinomycin, you can give Epis. If it is mitomycin, you can give arbovegetables. And if it is bleomycin, you can give Rustox, few doses. Then Vinca alkaloids, they are coming after using Vinca alkaloid, then you can give Vinca Crystin, or after giving Vinca Crystin or Vinblastin, you can give phosphorus as an antidote. If they are coming after radiotherapy, then you can give few doses of fluoric acid or strychnine or sulfur. If there is severe anemia following this radiotherapy, then you can give phosphorus or even arsenic acid. Then to spread the to prevent the lymphatic spread, you can give carbolic acid. Then blood spread, you can give a phosphorus. Then bone spread, you can give symphytum, that is mainly not 30, but you can give higher potencies to prevent the spread through to the bone. Then in case of a precancerous lesion, always use high potencies, and that mainly the anti-miasmatic drugs, especially if there is a family tendency. If there is a family tendency, and other drugs which comes, main drugs which comes are buforana and tarantula. Then recurrence can also be prevented by the drugs, China, arsenical, but this is having only limited value. It should be followed by anti-miasmatic drugs, which is in higher potencies. Then if the cancer is growing like anything or in a fast way, then you can give a cancerostatic action, and you can use of cadmium group of drugs. And that as an intercurrent remedy, you can give a calendula officinalis also to limit the growth of cancer. That is cancerostatic action by means of it's not carbonium self, it is a cadmium self, sorry, it is cadmium self. To modify the cancerous cachexia and cancer growing, you can give carcinosin and the gallium aparnate. Then in inoperable cases, such as extensive spread and all, the main medicine that comes is selenium. This I said earlier. That is usually the medicine that I used to give as first is melantrina. That is to prevent the deposit. Along with this melantrina, I use silicea also. And as an adjuvant, you can give vaccinum, verulinum, even melantrinum, and thuja. Malignancy without any external signs, or especially the skin malignancies and all, you can give a radium bromide and Kali arts. The main drug following treatment and the patient is coming with extreme prostration, the main drug is Califos. Last stages of cancer, to cure the pain, the main is ferrum magnesium and echinacea. To uh, to reduce the size and to destruct the cells of cancer, just like chemo, you can use thiocinaminum, calcarea floricum, silicea, and formalin. To prevent the adhesion, especially after surgery, you can use calcarea fluor. The detoxification, the cancerous conditions, you can give adrenaline, vanam, and condylom. To annihilate the cancerous tendencies, as first one, you can give carcinosin, hydrastis, phytolacca, and arsenic iodide. This is very important to prevent the microbes causing uterine as well as vaginal or penile cancers. You can give phytolacca as a preventive. Cancer running in families, you can give as a preventive buforana. To clean the remnants of after surgery, even after surgery, cleaning the remnants of cancer, you can give melandrinum. Especially patients coming after immunotherapy and all, you can give as a remedy bacillin. Then these drugs are generally used to prevent the progress of the disease: viscum album, cadmium sulf, and cadmium iodatum. To prevent the complications, I said in the first first topic, I mean, beginning itself, I said it is not the treatment side of the cancer, it is the preventive side of the cancer. How to prevent? The stricter prevention, you can give cantharis, the especially before operations, you can give a few doses of Staphylococcus also. If there is after surgery, if there is much manipulation of the internal organs resulting in pain, adhesions, and all, you can give a Bellis perennis. If there is bleeding after surgery, you can give arnica and phosphorus. If there is paralysis or stricture of the sphincters, you can give causticum. This is very important. After completing the treatment of cancers, the main drugs that you can use is gallium aparne. In addition to the gallium aparne, you can give a carcinosin, you can give Kali arts, and you can give a trifolium. Trifolium in female cases, especially uterine and ovarian cancers. Kali arts generally, then gallium aparne, if there is marked cachexia, carcinosin, of course, as you know, along with this carcinosin, you can give viscum alba also. When primary of the two, usually in some cases, you can comes to you after chemotherapy where it is. Then that cases, the main drug is sorinum, that especially, or that too should be in CM, sorinum CM. Then smoking producing lung cancers and all the. Then coming to prevention of cancer.
Yes.
Sorry.
Yes, there is some technical problem with your network. You can. Yes.
You are muted, doctor. Please unmute, Dr. Harikumar. Please unmute.
Okay. Can you hear?
Yes.
So I am concluding. if a case is coming to you after treatment, then that after completing the treatment, the possibility is, as you know, a very good number of 70% of cases will recur within a period of 5 to 10 years. So always institute preventive treatment by homeopathic medicines. And
Still, there is some network problem with you. We can't hear anything, sir.
cured that is in
Sir. Hello, we can't hear anything, sir. Please join.
Hello.
Yes. Now we can hear you. Please go back.
Okay. Okay. Now we can hear.
We couldn't. Yes, we couldn't hear you for the last 2 minutes. So you can
Okay.
talk from that point.
So take-home messages. One is usually the cancers will recur within 5 to 10 years. Majority of the cases will recur. So always a preventive role is there for homeopathy, and the prevention should start with a few doses of a carcinosin or with melandrinum or with the viscum album. Then you can treat the correct miasma dictate. In between, as intercurrent remedy, you should give aloes, calliards, or arsenic alb, or calendula, or gallium aparne, or even trifolium. These are the medicines which are used, which is a necessary to treat prevention of cancer. Then, according to me, one single medicine, one potency will not cure, will not result in prevention of cancer. No single medicine, no single dose. Always it requires multiple medicines and multiple doses to cure or to prevent cancer. Let me complete. Okay, thank you.
Okay. The thing was that we tried to upload the PPT, but unfortunately the PPT is not supporting to any of our. We have tried. I have tried. Dr. Kumar also tried, but he couldn't also. So that's the problem. Anyway, the presentation was superb, and it was just like 2020 game. It was in a big and thick and fast. Everything was thick and fast. So we couldn't catch as much as what you told. So it is better to run slowly because you are telling so many medicine every now and then, and people were finding it very difficult to even write down. That may be the problem. Anyway, tomorrow those who missed the session can we will upload the videos tomorrow so that those who want to write the same can watch it again, and you can take the note out of it, because lot of medicines covering cancer were discussed, and lot of medicines that can also prevent cancer also discussed. Sir, somebody was asking what is the potency you used to give for prevention, and what's your opinion on that? Is there any specific potency you feel?
Okay.
Somebody was asking.
Okay. Potency selection, in the initial part, I said the cancers can come from external to interior or internal to exterior. As an example said, in case of ill-fitting denture, it is from external to interior. From mental trauma and all, it is from internal to external. If it is internal to external, I always use highest potencies. That is my rule. Always use highest potency. For example, the former chief minister and all cancer because of the mental trauma caused. For him, if highest potencies, better you give above 50 cm like that. So if it is from internal to external, and especially from internal to external within a short period. Somebody in the family died, within 2 months the wife gets cancers, then in that case it is very short period, so you give highest potencies. And if it is the other way around, you can use lower potencies, then according to the condition you can gradually go up. So anyway, it requires highest potencies.
Okay.
Why highest potency? Because you have to reach the life is a stage. I said in the other webinars, three states are there: materialistic state, then second state is the dynamic state, and third state is the infant state. So sorry, infinity state. So if you to reach the infinity stage, your medicine is only dynamic. So it should work with the highest potencies, and with apt period is to be given to reach that state. Then only you will get, you can expect a cure or a palliation.
Okay. If anybody have a question, you can raise your hand or you can talk to Dr. Hari Kumar. Dr. Bob, what's your opinion on this presentation, and do you have any doubt on the preventive measures that can be done through homeopathy? Yes, Dr. Bob, please unmute.
Oh, this is a discussion, right? But
Yes, yes.
we have a lot of time more. Okay. What I suggest is for the preventive measure in homeopathy, we can take our biochemic tissue remedy. That is to boost our immune system and our vital force.
Right.
Which
Then also,
biochemic medicine you prefer for that?
I, we should also consider which one is best for us. You see, so we have to balance our system and balance our vital force. So usually we have to focus on the liver remedy like the Naturopause, then also the Calcarea Florida, and all this is also important, including Calcarea Carbonica and all this, and Ferrum Pause. So it is good that we take a supplement of biochemical on the job remedy, because we don't know where we are lacking unless we can check.
Have you ever tried the medicines suggested by Dr. Hari Kumar here?
By what? Sorry?
Have you ever tried the medicines suggested by Dr. Hari Kumar?
Doctor?
Hari Kumar was
Haniman?
Hari Kumar, today's guest.
Oh, no.
No. They say,
Because he did mention about arsenicum album. I think that is based on the constitutional remedy.
no. Lot of medicines were discussed.
Mm.
We have, because the presentation was so
But
fast.
you're asking about prevention,
Right.
is it?
Yes.
So there are many things we can do to prevent it. But I haven't tried whatever he suggested, so many of them. So that we must know that which remedy are suitable for us, you see. So according to Dr. Professor Whitakers, we should not keep on taking remedy because it might cause another kind of symptoms to appear. So we
Okay.
just take according to the symptoms that we are facing, presenting symptoms. Right.
Okay. Thank you. Now I'm inviting Dr. Manoj to say.
I think it's well past midnight. That's why Dr. Bob Lim is he may be in the sleepy mood. Around I think it's 1 a.m. there in the Philippines. Anyway, nice presentation. And what about the diet and regimen you advise in such cases, Dr. Hari Kumar, such cases? What is your suggestion?
Dr. Manas, regarding diet, and I have a difference of opinion. You may not agree with me, but thing is, my view is if you are giving dynamic drugs, that is potentized drug, nothing will interact with the diet or anything, because all the other things are in the materialistic stage. For the 48 years I am practicing, as you know, I never said you should not take this unless it is contraindicated in the disease, which is related to the disease. I always take even coffee advices. Only thing is, you should give the medicine in the potentized form. That too, 30 and above. If it is tincture, definitely will interact, and you should restrict that also. Why? Because tincture is a materialistic action, and your diet is also materialistic. If you are giving potentized drugs, high potencies, never it will interact.
Okay, well,
Yes.
my question is about the diet in the disease condition, as you mentioned, a lot of condition, and any suggestions regarding the diet in such cases?
No, that depends on the drug, disease condition only. If it is, for example, oh, right, please.
Yes, sir. Please proceed, sir. Please.
Hello.
Yes, please
Yes, yes.
continue, sir. Please continue.
Yeah, if I will advise restrictions of the diet only for that particular disease, not in general. Why? Because I said no. Your medicine is dynamic. Then how will you interact with the material? Nothing. If you are provided, but if you are giving tincture, it will definitely interact. I never use tinctures so far.
Okay.
And as the earlier foreign doctor told, no, biochemic. I never use biochemicals. Only potentized homeopathic medicines.
Okay. Dr. Rambarisu, sir, do you want to speak anything? Doctor, you can say what are thanks to the session also, Dr. Ram.
Thank you, Dhanesh ji, and everyone. Namaskar. Congratulations, Dr. Hari Kumar sir. Very nice presentation, excellent session. Prevention of cancer. Prevention of cancer according to homeopathic philosophy. First, cancer prevention, constitutional treatment, and miasmatic treatment. Miasmatic treatment. So constitutional treatment, miasmatic treatment, and lifestyle is a very important prevention of disease, cancer disease. Mental stress, suppression, and emotion, anger, grief, anxiety, etc. So, prevention of lifestyle is a very important. Lifestyle, tobacco, wine, habit. So, very, very thanks, Dr. Hari Kumar ji. Thank you. Behalf of IFPH.
Thank you, sir.
Very, very thank you, sir. Behalf
Thank
of
you, sir.
IFPH, again presentation. Thank you.
Thank you, sir.
Hargar Homeopathic, Hargar Homeopathy.
Seeing you, sir, always give me positive energy.
Yes. Positive energy is the better than cure of cancer.
Dr. Ajit, do you want to speak? Dr. Ajit? Yes, please unmute. If you want to speak, you can unmute. Yes. No. So, anyway, today it was really a brilliant session. Unfortunately, we are not able to share the slides. Definitely, we will upload the share slides next time, if possible, because we need some more presentations from Dr. Hari Kumar on this subject of cancer prevention and management. Of course, that will be the next presentation. How with that, we come to the end of the day, 2022, and tomorrow we will have a session from Dr. Damani Thakkar. She is the Associate Professor, Department of Practice of Medicine, Ahmedabad Homeopathic Medical College, and we'll be talking about homeopathic management of psychosomatic disorders. Oh, thank you.
Thank you.
Thank you, Dr. Hari
Thank you
Kumar,
all.
and those who
Thank
attend the session.
Thank you all.
Thank
Thank
you.
you. Good night. Good night.
Good night.
Good
Over
night.
to Dr. Manoj to moderate the Malayalam session.